I'm from Monterey County, upriver. And it's a great thing that our brothers, our sisters, our entire families up there in Maryland, United States of America, are so curious to know what's the livelihood of their brothers and sisters back home here in Liberia. Today, a whole group of young people, especially the new breed, have been victims of substance use and abuse. We've been working with Sister Malin. She's been doing extremely well. And today, our representatives have come to share our own ordeal with us. The country is suffering from a complete brain drain. Why? Because of the proliferation of hard and harmful substances on our society. It's a new phenomenon. We cannot really detect what the problems are, but we are calling on national government to see how best they can intervene. And almost close to 18% of the overall country's population that are using substance today. Majority of the young people are turned up to be harlots. They're having sex for money. Majority of our brothers today are victims of the use of substance. They are out there in the streets. They are languishing in prison because they turn out to be crime committers. So we want to say, wake up to the church. Wake up to our Liberian brothers out there. Wake up to national government. We need to change this thing. We need to stand up on our feet. We need to go against it. Those people who are there trafficking hard and harmful substances into our country through our borders, there needs to be an erection of a checkpoint. They need to checkmate them. Our laws needs to be harder and stronger. It should not be that weak. We want to say thank you. We want to say thank you to Sister Asia and the rest of our team that today they can create this platform. You think where the problem begins from? If the whole young generation are victims of the use of substance, then what becomes of us? What becomes of us? And mind you, it's not because that we are poor and we don't have money. That's why everybody is seeing our own. But those who are in government, it starts from the government officials, it's in the church, it's all over the place. So we need to come down hard on our feet, or else this country is going to be captured. This country is going to be called a drug state. Like, bro, it's going to change to Equatorial Guinea. The psychological effect of our young people's minds is going to be completely deteriorated. And who is it going to be attributed to? It's going to be attributed to Liberia and Liberians. So the board is in all of our schools. It's time for us to pose a challenge to one another to see how best we can work collaboratively in making this thing work. I want to say thank you. You guys are thinking about us. Don't forget about our Christmas is around the corner. Yeah, we can interact with you.
Can you introduce yourself again? Your name?
She wants you to please introduce yourself again.
My name is Julius Mature. I'm the National Public Relations Officer of all of the disadvantaged young people in Monterey County. I am mouthpiece for short. I talk on behalf of them. So I want to say thank you too for creating us this opportunity and this platform. It's a good thing. Let us continue to interact. Where we err, where we made the mistakes, let's correct those mistakes from there and get forward. For us, we are tired, not because we are here. We are not willfully, we are not willingly doing it, but because of these circumstances, we cannot go home. We need rehabilitation. We need our capacity building. We need to be reunited with our respective families. And once this thing starts working, Liberia is going to change. Liberia is going to turn around. So let us all work hard, and to make success still, and to get the ball rolling.
Thank you so much. Thank you. I just want you to know that we're recording this, if this is okay with you.
Yeah.
Yes, okay. And my name is Welma Redd, and I am the president of the LCA, Liberian Community Association in DC, Maryland, Virginia area. And I would like to introduce some other members of our team. On the call right now is Mr. Edman Zayzay and Mr. Arthur Doe. Edman Zayzay is part of this, what we call the Liberian Community in DC COVID-19 Task Force. And he will talk a little bit about what our task force is about. Mr. Zayzay.
Thank you, Madam President. And I would like to say a big thank you to Julius for the splendid introduction of his group and the activities they are involved with. I'm very proud of you, Julius, and your team, and I want to say congratulations also to Ms. King and everyone in Liberia. I would like to say thank you for accepting to speak with us today. The COVID task force, of which we are a part of, would like to come in and work with you all in understanding some of the challenges that you are faced with, especially with respect to getting access to potential coronavirus vaccination. And it's in that light that we are here today to talk with you, to understand, to get your feedback, to see whether this is the vaccination, how much access you have to it, whether some of you have gotten vaccinated, and how can we come about to help facilitate the process of getting you all vaccinated. And we definitely look forward to hearing about other things that you have to talk to us about. And as you said, we are all Liberians, and we are looking forward to continuously work with you. We don't necessarily have to be in top level position, but we care about every one of you, and we look forward to hearing your concerns again. Thank you, Julius. Julius.
So she said she wanted to hear about the challenges and things.
Like I was saying, some of those challenges that we have, the idea of sleeping place. We had an interaction. We had an interaction with one of the community members, Mr. E. Jerry Topa. But because he was being accused by community people that he was havoking criminals, group of people. So then majority of the people were relocated into the cemetery. And those smaller tents in there, these are the places that people sleep. So if we can have the opportunity to have military structure, one of the most important things is the sleeping place. You see how deteriorated the area is? You see, I think you can see ahead of you if you can keep a view. These are shattered things or structures that people fill in the cemetery to sleep. So these are the kind of areas that people sleep. So we are challenging, it's a challenge to all of us as Liberians. These are the places that people sleep. People use it as latrine. At the same time, people use it as bathroom. So this is how the place is laid out. This is, as you can see, this is how the place is laid out.
You use it as bathroom, everything.
People in the community use it as a latrine. At the same time, people sleep here.
Okay. One question. Ms. King, are you there?
A question. Yeah, I'm listening. I keep signing, please.
Okay. For Julius, we definitely understand the challenge that you guys have with respect to sleeping place. Also, have you guys also been reached out to get vaccinated with respect to the coronavirus?
So
people have individually, like for me, I did my J&J at the EWA hospital. Some people have individually, we have a structure here that because of the substance that we find ourselves using, we don't stay away from medical protocols. Can you imagine all of the COVID-19 from Ebola time up to now? There has not been a death victim here. So all of those protocols that can be put aside by national government because of our organizational structure, we don't bypass it. Many people here have been or have taken their vaccine and they got their ID card because we have 2 centers around us at the EWA hospital and at the same time the one ran by the district representative Samuel Enders. So people here are on course with COVID-19. Up to present, we still have our coolers here, our buckets. The only thing that we don't have sanitary, all the soap and chloride and stuff. But we have our buckets. If you go up the road, you will see the barrels there. People still washing their hands. People still wearing masks. Yeah, we're still taking our health protocols into consideration. Social distancing. So we're not just here vulnerably existing in the cemetery. We're following those norms in as much as we're risking ourselves. So we need immediate like healthcare. We need some antibiotics, essential drugs, because people sleeping outside in the cold, most especially that when you can disassociate yourself from it. Feeding, food.
Oh, no.
Food, my brother, it's not easy. I will continue to emphasize on it. Capacitating the people that want big thing that people will just can't take our picture. This, that, it.
Okay.
You've already costed, you can't get the access, and she knows that it's costing what, even before you people came. The people taking it here, brother, to be a business making thing.
That's right.
Not taking into consideration that it's a national jeopardizing of the global development of this nation. Why they overlooking?
Okay. So we feel your pain, and we realize my name is Welma Mashinini Redd. We realize, Welma Mashinini. I used to be, and normal day, I used to work on TV in Liberia. So what we want to do is we want to work with you. We want to do different things. We want to start with the feeding. We want to start with COVID, helping those who have not taken the vaccine yet, but we will work with CIS Israel to do
very sincere,
pay for some of the feeding programs. And in that program, because you know, in fact, before you can take the jab, before you take the vaccination, you got to eat. So if we feed people, they can go take the vaccination, and then we can still provide some of the things that you all need, whether that's Clorox or maybe some rice and oil and fish. So we want to work with her to organize this, but want to start with those who haven't yet taken the vaccine. I'm so happy to hear that you have taken your vaccination. So at least you know the importance. So let's work together and get the rest of our young men and women, you know, safe. We give them some food. And I want us to look at some other long-term programs after we do this particular COVID program. Israel has plans, as you know, to detox, to help people get off these substances. And we want to work with her with that too.
So I want to say thank you. It's good that we've already organized, we have a listing. So those people who have not been victims of successfully taking the COVID-19 vaccine, we're going to make sure we're going to have repeated awareness, re-emphasizing the importance of the vaccination. We're going to get vaccinated. We're going to keep people from there. Whatever it takes, she knows it all about working with us. She knows it all because she better relates to us. We've been together long, and she knows the pains at most that we feel. So we feel happy working with her. We trust her. She's so sincere. She's so passionate. She's loving. She's the kind of person that can dig up what your problem is. So we want to say thank you. Whatever the contingent plan that we have been working together, we hold that one. We pray that God bless the work of their hands, practicalize their intents, and save our country, Mama Liberia.
One of our members, Mr. Arthur Doe, he works in healthcare in America. Yeah, he's a consultant, a healthcare consultant. He works in a consultancy company.
Julius and my fellow Liberians. My name is Arthur Weah, and I work with Suburban Hospital John Hopkins, and is one of the top tier hospitals in America. And out of most of the data you can see on CNN, there's other area on news. John Hopkins is part of them. They are producing those numbers. I want to just let you know that the notion that people have that COVID, if you take the vaccine, you're going to get COVID. I think Julia can be the advocate to tell people, say that lie. And some of us who have taken the vaccine to let people know and let you guys know that indeed the vaccine does not give you COVID. You may feel sick when you take the vaccine, and so on. You may be sick where they give you the needle. It may be a little bit or so, but for people to just have to believe that the vaccine is giving people COVID, it is not true. And as I said, I don't want to be repetitive. And my president already said it, and my other colleagues already said it. We want to keep you guys safe. The thing here about the risks of taking the vaccine, if you really sick, you get all kinds of sicknesses in you. And then for some of us, we will tell you, say, don't take the vaccine. For instance, one person can get about 10 sickness. They can get diabetes, they can get asthma, they can get TB, they can get many. If that person is having those complications, I think will be good for the person not to take the vaccine and seek other medical alternatives to make sure that to kill some of those things, and because those things are long-term. But if you are not feeding anything for you to prevent yourself from the person who has those illnesses, it will be better for you to have the vaccine, to take the vaccine. The vaccine does not give you COVID. It is good. I have already taken my 2 shots. All of us that are in a hospital, that work in a hospital, from the president down to the sweeper, everybody take the vaccine. If you don't take the vaccine, you don't have a job. And furthermore, I also work with some people, the returnees, the military people who go for war in Iraq and other places who have PTSD, and, confused and whatsoever. I counsel them as well. And most of them have taken their vaccine, and we encouraging them to take the vaccine. And I also work with people in the vulnerable people like you guys who do drugs. And the notion that people who do drugs or the vaccine, we have fed them, it is not true. It is not true at all. The vaccine cannot affect them at all. Not because you are doing drugs, so you are vulnerable. No, absolutely. Statistics have proven that there has been absolutely no death, in fact, about those who are taking drugs. When they are vaccinated, they got killed from the vaccine. No. So Julius and the folks out there, we are here to help. You shouldn't be afraid of taking the vaccine. If you are not taking the vaccine yet, Julia is the rightful person who has taken the vaccine. He has his card. He is the advocate. Thank God he is your leader. Food will be available, etc., etc. So thank you so much for your time. And thank you, Dr. Redd and Israel.
Thank you so much. Thank you so much for your opportunity. Thank you so much.
Can we? Yeah, that you have a female, got a lot of female, yeah. You know how it is, the female in the ghetto, it's not an easy thing. Yeah, so somebody speak on behalf of you.
Yeah, every day the people then say they're coming for all, they can't reach. Now you go in the ghetto, people sick. People die in the ghetto now as I'm talking. Now they say, well, now I'm sick, seriously. Yeah, well, no food to eat. Yeah, what do we eat? Drop cassava. We can nowhere to go. We will fall on something. It can't shine on again. No clothes to wear. From here now we put it together to go have different men for money. We can't smoke drugs. When we can't smoke the drugs now, we'll be there when they finish now. They take the money back from us. And so they'll be there. They will have fun. And small now. We tired with it now. So really appealing to you for you to really find something for you to really do for us. Yeah, look at the play with lady now. As I'm talking now, we can walk just now. We see people sick. And the cassava eating here since this morning. I eating cassava, dry cassava. To get it, say, and I eat it. If I go pay, I will not get money. Look at young girls, then they're all young girls. They're all solo people in the cemetery living with the dead, sleeping with the dead. And solo be there now. But we get it here. We get our children in with us too. What did the crying behind us? We got nowhere to go. We're baking your mouth for your food. We need help. We need help. Now I'm going to buy packing my brother who has sex. So baking your mouth.
I said, for me, my ear, I don't have no parents here.
My heart is so touched for this baby right here, sis Weah. My heart is so touched. Yeah, if you're ready Monday, by the grace of God, I can pick you up on Monday. If you're ready and decide, I'm going to pick you up on Monday. You have a future. I can pick you up on Monday. How old are you? She's 16. That was the age of my daughter when she passed away. She's 16 years of age in there, Weah.
What's her name?
What's your name, darling? Tell Libby, hello.
Jessica.
Jessica, where are your parents? Your parents in Boston? Where your mom, your pa? That where all 20 live? Okay. What class is stopping? Sixth grade? Okay, she's 16 years of age. How old are you? She's 17. How old are you? How old are you? 16. How old are you? 16. How old are you?
17.
This is one of my old. How old are you? So when just in case if they start,
42 years old.
how old are you, Siri?
42.
How many children you got?
I guess 7.
She has 7 living children.
I'm 30 years of age. I got 3 children.
She got 3 children. So they said they gave their body out at night. When they go back again, the people come and beat them, take the money from them. They got nowhere to stay.
And I even find ourselves.
Wow.
These are the kind of life our sisters are living. It's not an easy thing. But people pretend like it's not happening. It's serious. The dead is the one giving accommodation to the living. But it's like you don't even exist. Like these children, probably they are not even in Liberia. That's how we see them, that they don't exist. We shut our eyes so much that we don't even see them. They only take the grace of God. So it's so good. Sis Katherine is here, and you can see what is happening. It's nothing like somebody have to wear in the spring. The first lady of the Republic of Liberia came to this very ghetto. I brought the first lady of the Republic of Liberia to this ghetto. I will never get tired. We continue talking and talking to see how we can have them transform.
Okay, Katherine, you have anything to add, Katherine?
You got something to say?
No, I don't like to talk plenty. You're not say everything, so there's nothing more that needs to be said.
So, Mom, you say your name again. You say your name again.
My name is Welma Mashinini.
Welma.
Welma Mashinini Redd. My name is
Action News.
Yes.
I was small and I remember
my name is Mature. I'm Julius Mature. It's good that we've already talked about. And it's there with you people. It's there with you.
Okay, your boy say he won't perform for you. Okay, go ahead.
Oh, we got artists and all there.
Yeah, you got Mason on here.
They're talented young people.
Yeah.
They're talented young people. We can't sit back, we
Absolutely.
in the diaspora cannot sit back and only deal with the people who are all right.
I think this is a good experience, and we definitely have a lot more to talk about and work with them. I think it's really great, and Asia is doing a really good job too.
Okay. Valuable. This is so good.
I think after this we should have a
I
recap.
said, each of us, we have to send a donation through Katherine
Absolutely.
to share with them. I think she's on. What you call it? We will talk to her afterwards. What should we authorize?
Let's recap after this.
Okay.
Oh, you take me back home, Julius. You take me to Saigon.
Okay, so we thank you. We don't want to take Katherine. Can we have a private meeting with you quickly?